I'm Dr. Dan. I'm talking to you from Vitamin Pro, and we're discussing a little bit about the thyroid. Now, I was at a 3-day conference some months ago, and very fascinating, lots of information on the thyroid. We're trying to break that 3 days down into 3 minutes here and give you the real basics. And so what you need to understand first off is that thyroid hormone affects virtually every cell in your body. So the metabolic rate of each cell will be controlled by that, including brain, of course. Now, if you're low in thyroid, your brain can't work properly because it's going to be subject to fatigue a lot more easily. Now, the thyroid regulation and control is governed by about 8 or 9 steps, and you can measure several of these with blood tests, but you can't measure them all, but you can measure some of these. The disturbing trend in medicine right now is they tend to measure just one step, which is thyroid stimulating hormone, or TSH. And of course, based on your TSH levels, then they'll give you different types of drugs, or the treatment protocols will be a little bit different. But it's important to realize that it's not that easy. And a low or high TSH gives you one piece of information, but you need to gather more in order to decide what's going on. So what we like to do is run a more complete test, look at some of the T3 levels, some of the T4 levels, and also it's extremely important to check antibodies, TPO and antithyroglobulin, to see, because autoimmune problems related to thyroid are very common. And how your thyroid is treated is going to depend on exactly what's going on. And like I said, you can't tell from a TSH what's happening with the whole system. So anyway, that's how we like to approach it. Now, if you have autoimmune problems, we need to discuss that and treat that completely differently than you would just low thyroid because of deficient iodine or something. So anyway, basics: thyroid, good blood test is important, necessary to know what's happening. Treatment's going to be different depending on what shows up there, and how we go about that is going to depend on the results of this test and maybe other tests, maybe like cytokines or some other things too. So anyway, we like to look at the whole picture the best we can so we can make an intelligent choice about your health, which of course is paramount to you. So that's kind of a basic overview, and hopefully that was helpful for you. So thanks for listening.